Hi, I'm Dr. Eric Benefield at Grand Dental here in Grand Junction, Esteem Dental Implants. Just wanted to do a little video to help educate as far as the topic of dental implants. Implants are something that we talk about all the time. We see billboards and stuff, but not everybody has a full understanding of what implants are. So first thing we can do with dental implants, if you're missing one single tooth, you had to have that tooth pulled for whatever reason, or maybe it never came in that tooth root space where the natural tooth root is supposed to be, we can put an artificial titanium root called a dental implant, and our bone grows right up to that titanium. And so after several weeks, that bone will be fused to the dental implant. Once that's happened, then we can take a crown and just attach it right to the implant. And once that's fastened into place, then it just stands on its own like a natural tooth. It bites like a tooth, it feels like a tooth, and it looks like a tooth. And so it literally is the most like a natural tooth that we can do in dentistry. And you've probably seen people that had dental implants and didn't know it because they just look like a tooth. So if you're missing one tooth, a dental implant can be a really good way to go, and it helps to preserve the natural teeth around it that are already healthy rather than doing any kind of grinding down on them or anything like that. Some people are missing more than one tooth in a row, so maybe you're missing 2 or 3 or 4 teeth in a row. We can replace each individual tooth with an implant, or we can use a couple of implants and do a little bridge between those implants, again, just to replace a row of teeth so that it looks natural and feels natural, and you're able to chew with it. Now, let's say you're missing all of your teeth and you need a whole set. Some people are already wearing a denture. Some people maybe don't have a denture yet, but they need to get their teeth out and have some kind of a replacement. Most people's complaints about dentures are that they're uncomfortable, that they shift around, it's hard to eat with them, they have to use glue, stuff doesn't taste the same because their palate's covered. So, there's a lot of reasons why a denture is not the greatest replacement for teeth. Look like teeth, but for a lot of people, that's all they do as far as resembling teeth. When it comes to function, they're just not the same. So if you want your denture to function more like teeth do instead of a denture, then we can make you what's called an overdenture. And all that is, it's just like a denture, except for on the underside, it has these little fittings that snap into implants. And so if you have a denture on your lower jaw, then we can put some implants down there. And then once the bone has grown up around those implants, then that overdenture just snaps right into it. And once it's snapped into the implants, then it's tight, it's solid. You pop them out if you want to, but they don't come out on their own. So an overdenture can be a real good way to secure your denture so that you don't have to use glue, or you don't have to feel them moving around and feel uncomfortable. If you do a top overdenture, then we don't have to have the palate covered with acrylic anymore, like a regular denture. And so it's easier to talk, it's easier to taste. There's just a lot of positive that comes from not having that palate covered. So whether you already have a denture and you feel like you want to convert over to something more stable and solid, or if you think you need to be getting a denture but you don't really want to have the problems that a lot of people have with dentures, then maybe an overdenture is right for you. Another way that we can replace a whole set of teeth is permanently fixed into implants. So kind of like the overdenture, we put somewhere between 4 and 6 implants into your upper jaw, or 4 to 6 implants in your lower jaw, and we use those implants to support a whole set of teeth, but those teeth don't snap in and out. They're screwed into the implants. And so from the very first day that we take your teeth out and put those implants in, or if you already have your teeth out, the first day that we put the implants in, then we take a temporary and we screw it into those implants to where you've got a solid set of temporaries while you're healing, and right off the bat you'll be able to feel that they're very solid and very functional. You wear those temporaries for a few months while those implants are healing, and then we make you a final set of teeth that's very, very strong. It's designed to be screwed in permanently and really not be removed unless we need to. So if you had to have it come out, then we can unscrew it and take it out and clean around the implants and refasten it back in. Hopefully that gives you some food for thought as far as what the capabilities of dental implants are. Whether you're missing a single tooth or a couple of teeth and we need to just look at how to replace one or two missing teeth, whether you need a whole new set and you think maybe you want to support a denture snapping in and out, or whether you need a whole new set but you want it to be more like natural teeth to where it doesn't snap in and out. Any of those options are something that we can look at doing with dental implants. So if you feel like taking the next step, then again, fill out the evaluation form. We'll get in contact and sit down and have a consultation together and figure out what's right for you. Can't wait to meet you. Can't wait to help you get a great smile with Esteem Dental Implants.